Hello, my name is Chris Andrews, and I am the CMO of Allimetry. I'm also a gastroenterologist who specializes in motility. Today, I'm going to show you the new gastric allimetry report, which is new for 2026. It has the new summary front page. It has all the old data from the old allimetry report, but it's just more condensed with a summary front page that can give you a lot of the information and can really aid in more rapid reading of the allimetry reports. So I'll go through this report with you and we'll get right to it. So this is a 43-year-old woman who came with a clinical history of nausea and vomiting and a long-standing history of diabetes with complications. And so with the new front page, you can see that it's actually divided into spectral analysis summary, symptom analysis summary, the telemetry gut brain well-being summary, and the test quality and protocol used summary. So as I usually do, I just go first to the protocol quality assessment down in the lower left corner. And we just want to confirm what kind of standard meal they used. And in this case, it was the standard Cliff Bar and onshore drink, which was 490 calories, and the patient was able to consume 100% of the meal. We also noted that the design of the study was standard, so they did 4 hours, 38 minutes, which means that they did at least a 4-hour postprandial assessment. And the artifacts, which generally should be less than 50%, you can see here we're only 17.5%. So overall, the test quality is accurate are adequate, and we can move forward analyzing the study. So the next thing I look at first is the spectral analysis. And here you can see that not only does it give you the new spectral analysis, but overall the metrics for the gastric allimetry study. And so just by looking at it, you can see that there's no obvious sustained frequency that's propagated throughout the study. And you can see that consistent with that, the gastric allimetry rhythm index is only 0.18. So it's less than 0.25. And this is consistent with a dysrhythmic phenotype. There is, however, gastric electrical activity occurring, and you can see that the BMI adjusted amplitude is within normal range at 34. And since the computer was not able to identify a sustained frequency that was dominant, there was no measured principal gastric frequency. So overall, again, clinically, this is consistent with a dysrhythmic phenotype, and you can see that the new addition is that the software will actually confirm that for you as well, that the metrics are consistent with the dysrhythmic gastric activity. So moving on, the symptom analysis. This actually now groups the symptoms into nausea and vomiting, pain, postprandial distress, and burning and reflux symptoms. And you can see that this patient actually had no nausea or vomiting throughout the study. This is again the symptom analysis. The pain symptoms were 6.5 out of 10. Postprandial distress was 5.5 out of 10. And burning and reflux was lower at 2.5. Another thing I'll point out is the new use of what we call tags. So when the pain symptoms, in this case, they were continuous throughout the study, so they were pretty much the same before the meal as after. It does label that as continuous, whereas with postprandial distress, the symptoms onset afterwards, and these were meal induced. I'll show that in more detail on the symptoms page. And then the burning and reflux symptoms, they did have, to a lesser degree, a later onset in the study. And again, this tagged it that way. And then finally, for the gut-brain well-being, the depressive symptoms were found some of the time, stress was some of the time, and anxiety was most of the time. And I should note that, again, this does not diagnose a mental health condition, but is helpful to often corroborate management plans, especially in the context of the overall patient history and per the clinician discretion. So that's all brought to you in that summary page, and that actually makes it a lot easier to just see right out of the gate that the spectrum looks dysrhythmic, the quality was accurate. There are symptoms that some of which are continuous and some of which are meal-induced and some of which were later onset. And then there is some summary data from the gut-brain well-being. Now, all the old data that you used to look at in the old report is still there. And so moving to the next page, you can see that this gives you both the spectrum and the amplitude curve side by side for correlation purposes, as well as the total symptom burden. So you can get a very good summary picture of what direction the symptoms were going. We also have all the spectral metrics broken down on an hourly basis for your perusal. On the symptoms, you can see that the symptoms are, again, now grouped into overall categories. So we have nausea and vomiting together, we have upper gut pain, and we have postprandial distress type symptoms, including bloating and fullness and early satiation. And then finally, stomach burn and heartburn were all there. So you can see that the pain symptoms are relatively continuous and again tagged with this continuous tag. You can see that the postprandial, the bloating is meal-induced, and these are more helpful, particularly when you're looking at symptom phenotypes where the spectral analysis is normal. And then for the heartburn, they did get some heartburn quite a bit later on in the study, which is tagged as late onset, which is correct, but I don't think that that is necessarily a prominent or particularly relevant finding in this situation. We still have the correlation curves, and this measures both the gastric electrical activity as well as the symptoms over time. And you can see that there is really no significant correlations at all between the symptoms and the gastric electrical activity. And then finally, the gut brain well-being is broken down into the individual questions for we can look at. And then finally, we do have the technical page, which just allows you to look at both patient movement to correlate with artifacts, as well as any technician comments that your technician may have put in during the test. So in summary, this is a 43-year-old woman who had a longstanding history of diabetes, as well as nausea, vomiting, and phenotype is quite clearly dysrhythmic, and this would be fitting with a diagnosis of a gastric neuromuscular disorder or possibly gastroparesis. So thanks for listening today, and hope to see you again soon.